Have you ever wondered why it seems so much harder to stay balanced as we age, especially after 60? The truth is, there are several reasons for this decline. Our muscles and bones naturally weaken over time, making it harder to maintain stability. The inner ear, responsible for helping us sense our body's position, can lose its effectiveness. Additionally, our vision may not be as sharp, making it difficult to see potential hazards. Medications can also play a role in affecting our balance. In this video, we'll delve into 19 common reasons for balance loss after 60. Stay tuned until the end for crucial insights on reason number 15. Don't forget to like, share, and subscribe for more valuable health tips. First on our list, number 1. Vestibular dysfunction. Vestibular dysfunction is a critical factor in balance loss, particularly as people age. The vestibular system, situated in the inner ear, is responsible for detecting motion, head position, and spatial orientation. When this system malfunctions, it can lead to symptoms such as dizziness, vertigo, and unsteadiness, all of which can contribute to falls. In fact, according to the National Institute on Deafness and Other Communication Disorders, NIDCD, vestibular disorders are among the leading causes of balance issues in older adults, affecting millions of people worldwide. There are several causes of vestibular dysfunction, ranging from benign paroxysmal positional vertigo, BPPV, to more serious conditions like Meniere's disease. BPPV, for example, occurs when tiny calcium crystals within the inner ear become dislodged and interfere with normal balance signals. This condition is common in older adults and can cause intense dizziness with specific head movements. Meniere's disease, on the other hand, is a chronic condition that leads to episodes of vertigo, hearing loss, and tinnitus due to fluid buildup in the inner ear. Age-related changes in the vestibular system also play a significant role. As we age, the number of sensory hair cells within the inner ear decreases, reducing the efficiency of the vestibular system. This decline in function can make it harder for older adults to maintain balance, especially in situations where their vision or proprioception is compromised. Research supports the importance of vestibular rehabilitation therapy, VRT, in managing vestibular dysfunction. VRT involves specific exercises designed to improve gaze stability, posture, and overall balance by retraining the brain to rely on alternative sensory inputs. This therapy has been shown to significantly reduce dizziness and improve balance in older adults with vestibular disorders, thereby lowering the risk of falls. Moving to number 2. Muscle weakness. Muscle weakness is a significant contributor to balance loss in older adults. As we age, our muscles naturally lose strength and mass, a process known as sarcopenia. This reduction in muscle power can make it challenging to maintain stability, particularly when walking, climbing stairs, or standing up from a seated position. Research from the National Institutes of Health, NIH, indicates that muscle strength declines by about 1–2% per year after the age of 50, with a more rapid decline occurring after age 60. This loss of strength directly impacts an individual's ability to maintain balance and prevent falls. Muscles play a critical role in stabilizing the body, especially the core muscles, which include the abdominal and back muscles. These muscles help maintain posture and provide support for movements. When core muscles are weak, the body is more prone to sway, making it difficult to recover from minor disturbances in balance. Additionally, weak leg muscles, particularly the quadriceps and hamstrings, can reduce an individual's ability to stand up, walk steadily, and react quickly to prevent a fall. The weakening of muscles isn't just a result of aging alone. Sedentary lifestyles, poor nutrition, and chronic diseases like diabetes or heart disease can accelerate muscle loss. For example, prolonged inactivity leads to muscle atrophy, where muscles waste away due to lack of use. This is particularly concerning for older adults who may be less active due to mobility issues or chronic pain, further exacerbating muscle weakness and increasing the risk of falls. Scientific evidence supports the idea that strength training can combat muscle weakness and improve balance. A study published in the Journal of Aging Research found that older adults who engaged in regular resistance training experienced significant improvements in muscle strength and balance. Exercises like squats, lunges, and leg lifts target key muscle groups and can be modified to suit various fitness levels. Even moderate resistance exercises, when performed consistently, can make a substantial difference in maintaining muscle mass and reducing the risk of balance-related falls. Moving to number 3. Vision changes. Vision plays a crucial role in maintaining balance and spatial orientation. As people age, changes in vision can significantly impact their ability to stay balanced. These changes include reduced visual acuity, decreased contrast sensitivity, and a narrower field of view. According to the American Academy of Ophthalmology, age-related vision problems such as cataracts, glaucoma, and macular degeneration become more common after the age of 60. These conditions can make it difficult to perceive obstacles, judge distances, and navigate uneven surfaces, all of which are essential for maintaining balance. Reduced visual acuity, or clarity of vision, can make it challenging to see potential hazards, such as curbs, steps, or small objects on the ground. This can lead to tripping and falling, particularly in low-light conditions. Contrast sensitivity, which is the ability to distinguish objects from their background, also declines with age. For example, an older adult may struggle to see a dark rug on a dark floor or differentiate between the edge of a step and the step itself, increasing the risk of a fall. The narrowing of the visual field, often referred to as tunnel vision, further complicates balance. A person may not see peripheral obstacles or changes in terrain, which can lead to missteps. This is particularly dangerous when walking in crowded or unfamiliar environments, where the risk of encountering unexpected obstacles is higher. Scientific studies have shown that improving lighting, wearing prescription glasses, and undergoing regular eye checkups can help mitigate the effects of age-related vision changes on balance. A study published in the journal Age and Aging found that older adults who had cataract surgery experienced significant improvements in both vision and balance. Ensuring that visual aids are up to date and that environments are well lit and free of visual clutter can also help reduce the risk of falls related to vision changes. Next, number 4. Inner ear issues. The inner ear, specifically the vestibular system, plays a vital role in maintaining balance by detecting head movements and sending signals to the brain. As people age, various issues can arise within the inner ear that disrupt this system, leading to balance problems. Conditions such as benign paroxysmal positional vertigo, BPPV, Meniere's disease, and labyrinthitis become more prevalent with age and can cause dizziness, vertigo, and unsteadiness. BPPV, one of the most common inner ear issues in older adults, occurs when tiny calcium particles clump up in the canals of the inner ear, disrupting the normal flow of fluid that helps sense motion. This can lead to brief episodes of intense dizziness, particularly when changing positions, such as getting out of bed or bending down. According to a study published in Otolaryngology Head and Neck Surgery, BPPV is more prevalent in individuals over 60 and significantly contributes to fall risk. Meniere's disease, another inner ear condition, involves episodes of vertigo, hearing loss, and tinnitus. Although less common, it can severely impact balance, making everyday activities difficult and increasing the likelihood of falls. Labyrinthitis, an infection or inflammation of the inner ear, can also cause sudden dizziness and balance issues, although it is usually temporary. Scientific evidence supports vestibular rehabilitation therapy, VRT, as an effective treatment for inner ear-related balance problems. A study in the Journal of Vestibular Research found that VRT significantly improved balance and reduced dizziness in older adults. Regular checkups with an ear, nose, and throat specialist can help diagnose and manage these conditions, ultimately improving balance and reducing fall risk. Now, number 5. Medications. Medications are another critical factor that can influence balance in older adults. As people age, they are often prescribed multiple medications for various chronic conditions, a situation known as polypharmacy. Certain medications, especially those that affect the central nervous system, can cause dizziness, drowsiness, and a loss of coordination, all of which can contribute to balance problems and increase the risk of falls. Common medications that can affect balance include antihypertensives, used to lower blood pressure, sedatives, antidepressants, antipsychotics, and even some over-the-counter medications like antihistamines. According to a study published in Drugs and Aging, older adults are more sensitive to the side effects of these medications due to changes in how their bodies metabolize drugs. This increased sensitivity can exacerbate balance issues. In particular, Medications that lower blood pressure too much can lead to orthostatic hypotension, a sudden drop in blood pressure when standing up, causing dizziness and fainting. Similarly, sedatives and sleep aids can impair motor function and slow reaction times, making it harder to maintain balance. It's important for older adults and their healthcare providers to regularly review all medications to assess their potential impact on balance. Adjusting dosages, switching medications, or finding alternative treatments may help reduce the risk of falls. A comprehensive review of medications by a healthcare provider, ideally a pharmacist or a geriatric specialist, can ensure that any balance-related side effects are minimized while still effectively managing chronic conditions. Following this, number 6. Neurological conditions. Neurological conditions, including Parkinson's disease, multiple sclerosis, MS, and stroke, can significantly impact balance and coordination. These conditions affect the brain and nervous system, leading to muscle weakness, tremors, and difficulty with movement, all of which contribute to balance issues in older adults. Parkinson's disease, a progressive neurological disorder, is particularly associated with balance problems due to the loss of dopamine-producing neurons in the brain. This leads to a range of motor symptoms, including tremors, rigidity, and postural instability, which can make it difficult for individuals to maintain their balance and avoid falls. A study in the journal Movement Disorders found that over 60% of individuals with Parkinson's experience falls each year, with many falling multiple times. Multiple sclerosis, another neurological condition, damages the protective covering of nerves, disrupting communication between the brain and the body. This can result in coordination issues, muscle weakness, and balance problems. Similarly, stroke survivors often experience balance issues due to muscle weakness, loss of sensation, and impaired coordination on one side of the body. Scientific research highlights the importance of physical therapy and exercise in managing balance issues related to neurological conditions. A study published in Neurorehabilitation and Neural Repair found that balance training exercises significantly improved stability in individuals with Parkinson's disease. Additionally, regular follow-ups with a neurologist and tailored rehabilitation programs can help manage symptoms and improve balance, reducing the risk of falls. Next, number 7. Decreased proprioception. Proprioception, often referred to as the body's sixth sense, is the ability to perceive the position and movement of the body in space. This sense is crucial for maintaining balance, as it allows individuals to make subconscious adjustments to their posture and movements. As people age, proprioception tends to decline, making it more challenging to stay balanced, particularly in situations that require quick reactions or when navigating uneven terrain. This decline in proprioception is often due to changes in the joints, muscles, and nerves. For example, age-related degeneration of joint receptors, known as mechanoreceptors, can reduce the sensitivity of the body's position sense. Additionally, peripheral neuropathy, a condition that affects the nerves in the extremities and is common in older adults, can further impair proprioception. A study in the Journal of Geriatric Physical Therapy found that reduced proprioception is strongly associated with an increased risk of falls in older adults. Exercises that improve proprioception, such as balance training, yoga, and Tai Chi, have been shown to be effective in reducing the risk of falls. A review in Age and Aging found that older adults who participated in balance and proprioceptive training programs experienced significant improvements in their ability to maintain stability. Incorporating such exercises into daily routines can help older adults maintain and even improve their proprioceptive abilities, enhancing overall balance. Up next, number 8. Arthritis and gait abnormalities. Arthritis, particularly osteoarthritis, is a common condition in older adults that affects the joints, leading to pain, stiffness, and inflammation. As arthritis progresses, it can cause gait abnormalities, alterations in the way a person walks. These abnormalities can, in turn, lead to balance problems and an increased risk of falls. Osteoarthritis typically affects weight-bearing joints like the knees, hips, and spine. The pain and stiffness associated with arthritis can cause individuals to compensate by changing their gait, such as limping or favoring one side of the body. This uneven distribution of weight can destabilize the body's center of gravity, making it harder to maintain balance. According to a study in the Journal of Rheumatology, individuals with knee osteoarthritis are 30% more likely to experience falls compared to those without arthritis. Rheumatoid arthritis, an autoimmune condition that affects the joints, can also lead to gait abnormalities and balance issues. In this condition, the body's immune system attacks its own tissues, causing chronic inflammation in the joints. This not only leads to pain and stiffness but can also result in joint deformities that further impact gait and stability. To manage balance problems associated with arthritis, physical therapy and targeted exercise programs are essential. Strengthening the muscles around the affected joints can help support them, reducing pain and improving gait. A study published in Arthritis Care and Research found that strength training and aerobic exercises significantly improved gait and balance in older adults with arthritis. Additionally, using mobility aids, such as canes or walkers, can provide extra support and stability, reducing the risk of falls. Next on the list, number 9. Low blood pressure, or hypotension, particularly orthostatic hypotension, is another factor that can contribute to balance problems in older adults. Orthostatic hypotension occurs when blood pressure drops suddenly upon standing up, leading to dizziness, lightheadedness, and, in some cases, fainting. This sudden drop in blood pressure can make it difficult to maintain balance, increasing the risk of falls. Orthostatic hypotension is often a result of age-related changes in the cardiovascular system. As people age, the blood vessels become less elastic, and the body's ability to regulate blood pressure diminishes. Medications, dehydration, and certain medical conditions, such as diabetes and Parkinson's disease, can also contribute to low blood pressure and its associated symptoms. According to a study in the Journal of the American Geriatric Society, older adults with orthostatic hypotension are significantly more likely to experience falls. The study found that even mild drops in blood pressure upon standing could increase the risk of falls by 50%. Therefore, it's crucial for older adults and their healthcare providers to monitor blood pressure regularly and take steps to manage low blood pressure. Simple interventions, such as staying hydrated, rising slowly from a sitting or lying position, and wearing compression stockings, can help prevent sudden drops in blood pressure. For those on medications that lower blood pressure, healthcare providers may need to adjust the dosage or explore alternative treatments to minimize the risk of orthostatic hypotension and related balance issues. Continuing with number 10. Diabetes, particularly type 2 diabetes, is a prevalent condition among older adults that can affect balance in several ways. One of the primary ways diabetes impacts balance is through peripheral neuropathy, a condition where high blood sugar levels damage the nerves, particularly in the extremities. This nerve damage can lead to numbness, tingling, and loss of sensation in the feet and legs, making it difficult to feel the ground and maintain balance. A study published in Diabetes Care found that individuals with diabetic neuropathy are twice as likely to fall as those without the condition. The loss of sensation in the feet can make it challenging to gauge the position of the feet and adjust posture, leading to unsteady gait and balance issues. In severe cases, diabetic neuropathy can also affect the nerves responsible for muscle control, further compromising balance. In addition to neuropathy, diabetes can lead to other complications that affect balance, such as vision problems, due to diabetic retinopathy, and low blood sugar, hypoglycemia, which can cause dizziness and confusion. Hypoglycemia, in particular, can lead to sudden balance issues if blood sugar levels drop too low, causing weakness and disorientation. Managing diabetes effectively is crucial for reducing the risk of balance problems. This includes maintaining healthy blood sugar levels through diet, exercise, and medication, as well as regular foot care to prevent and address any issues related to peripheral neuropathy. Engaging in balance exercises and physical therapy can also help improve stability and reduce the risk of falls in individuals with diabetes. Next in line, number 11. Cardiovascular issues such as heart disease, arrhythmias, and heart failure can significantly impact balance in older adults. The heart and blood vessels play a critical role in supplying oxygen and nutrients to the muscles and brain, which are essential for maintaining balance and coordination. When cardiovascular function is impaired, it can lead to symptoms like dizziness, fatigue, and shortness of breath, all of which can affect balance. Heart disease, including conditions like coronary artery disease and heart failure, reduces the heart's ability to pump blood effectively. This can lead to poor circulation and reduced oxygen supply to the muscles and brain, making it difficult to maintain balance. A study in the Journal of the American Heart Association found that older adults with heart failure are at a higher risk of falls due to balance problems associated with reduced cardiac function. Arrhythmias, or irregular heartbeats, can also lead to balance issues. When the heart beats too fast, too slow, or irregularly, it can cause blood pressure fluctuations and reduced blood flow to the brain, leading to dizziness and lightheadedness. In some cases, arrhythmias can cause fainting, which poses a significant fall risk. To manage balance problems related to cardiovascular issues, it's essential to work closely with a healthcare provider to manage the underlying heart condition. This may involve medications, lifestyle changes, and, in some cases, surgical interventions. Regular cardiovascular exercise, under medical supervision, can also help improve circulation and overall cardiovascular health, which in turn can enhance balance and reduce the risk of falls. Next, number 12. Foot problems, such as bunions, corns, calluses, and plantar fasciitis, can significantly impact balance in older adults. Healthy feet are essential for maintaining stability, and any issues with the feet can disrupt a person's gait and posture, leading to balance difficulties. Bunions, for example, are bony bumps that form on the joint at the base of the big toe, causing the toe to angle towards the other toes. This misalignment can alter the way weight is distributed across the foot when walking, leading to instability. Corns and calluses, which are thickened areas of skin caused by pressure and friction, can also cause discomfort and make it difficult to walk properly. Plantar fasciitis, a condition characterized by inflammation of the tissue that runs along the bottom of the foot, can cause severe heel pain, further affecting gait and balance. A study published in the Journal of Foot and Ankle Research found that older adults with foot pain and deformities were more likely to experience falls compared to those without foot issues. The researchers emphasized that foot health is a critical component of fall prevention in older adults. To address foot problems and improve balance, it's important to wear properly fitting footwear that provides adequate support. Orthotics, or custom shoe inserts, can help correct foot alignment and reduce pressure on painful areas. Regular foot care, including keeping the feet clean and moisturized and addressing any issues early on, can also prevent problems from worsening. In cases of severe foot pain or deformities, consulting with a podiatrist for specialized treatment may be necessary. Following that, number 13. Cognitive decline, which includes conditions such as mild cognitive impairment and dementia, can also contribute to balance problems in older adults. The brain plays a crucial role in coordinating movement and maintaining balance, and when cognitive function is impaired, it can lead to difficulties with these tasks. In conditions like Alzheimer's disease and other forms of dementia, the brain's ability to process information and make decisions is compromised. This can affect a person's spatial awareness, attention, and ability to plan movements, all of which are essential for maintaining balance. For example, an individual with cognitive decline may have difficulty judging distances or recognizing obstacles, increasing the risk of tripping and falling. A study in the Journal of the American Geriatric Society found that older adults with cognitive impairment are twice as likely to experience falls compared to those without cognitive issues. The study highlighted the importance of addressing cognitive decline as part of fall prevention strategies. To manage balance problems related to cognitive decline, it's important to create a safe and structured environment. This may involve removing tripping hazards, using assistive devices, and ensuring that the individual has proper supervision when necessary. Cognitive training exercises and physical activity have also been shown to help maintain cognitive function and improve balance in older adults. Additionally, managing other risk factors, such as vision and hearing problems, can further reduce the risk of falls. Coming in next, number 14. Poor nutrition can have a significant impact on balance in older adults. A balanced diet is essential for maintaining muscle strength, bone health, and overall physical function, all of which play a role in stability and balance. When older adults don't get the nutrients they need, it can lead to muscle weakness, fatigue, and even conditions like osteoporosis, which can contribute to balance problems and increase the risk of falls. Malnutrition, which is common among older adults due to factors such as decreased appetite, difficulty chewing, and limited access to healthy foods, can lead to a loss of muscle mass and strength, known as sarcopenia. According to a study in the American Journal of Clinical Nutrition, sarcopenia is a major risk factor for falls in older adults, as weaker muscles are less able to support the body and maintain balance. Vitamin D and calcium deficiencies, in particular, are associated with poor bone health and an increased risk of falls and fractures. A lack of vitamin D can lead to weaker bones and muscles, making it harder to stay steady on your feet. The Journal of Bone and Mineral Research found that older adults with low levels of vitamin D had a higher risk of falls compared to those with adequate levels. To prevent balance problems related to poor nutrition, it's important for older adults to maintain a well-rounded diet that includes plenty of protein, fruits, vegetables, and whole grains. Supplements may also be necessary to address deficiencies in key nutrients like vitamin D and calcium. Additionally, staying hydrated is crucial, as dehydration can lead to dizziness and balance issues. Up next, number 15. Lack of physical activity. Lack of physical activity is a major contributor to balance problems in older adults. Regular exercise is essential for maintaining muscle strength, flexibility, and coordination, all of which are necessary for good balance. When older adults become sedentary, they lose muscle mass and flexibility, making it more difficult to stay steady on their feet. Physical inactivity can also lead to a decline in cardiovascular health, which affects circulation and the delivery of oxygen to the muscles and brain. This can result in fatigue and dizziness, further impacting balance. A study in the Journal of Aging and Physical Activity found that older adults who engaged in regular physical activity had better balance and were less likely to experience falls compared to those who were sedentary. Balance exercises, such as Tai Chi, yoga, and strength training, can help improve stability and reduce the risk of falls. These activities focus on enhancing core strength, flexibility, and coordination, which are all crucial for maintaining balance. Additionally, weight-bearing exercises like walking and resistance training can help prevent osteoporosis and maintain bone health, reducing the risk of fractures from falls. To combat balance problems related to physical inactivity, it's important for older adults to incorporate regular exercise into their routine. Even small amounts of activity, such as walking or stretching, can make a difference in maintaining balance and overall health. Following that, number 16. Dehydration. Dehydration is a common issue that can significantly impact balance in older adults. Water is essential for maintaining many bodily functions, including those that regulate balance and coordination. When the body is dehydrated, it can lead to dizziness, confusion, and an increased risk of falls. As people age, their sense of thirst often diminishes, which can result in insufficient fluid intake. Additionally, older adults may have a reduced ability to concentrate urine, leading to more frequent urination and potential fluid loss. This can exacerbate dehydration, especially if fluid intake is not adequately replenished. According to a study published in the Journal of Nutrition, Health and Aging, dehydration can cause a decline in cognitive function and alertness, increasing the risk of falls. The study found that older adults who were dehydrated were more likely to experience balance problems and have a higher incidence of falls compared to those who maintained proper hydration. To prevent dehydration and its effects on balance, older adults should be encouraged to drink fluids regularly throughout the day, even if they do not feel thirsty. Water is the best choice, but other fluids like herbal teas and broths can also contribute to hydration. Monitoring fluid intake and ensuring that any underlying medical conditions contributing to dehydration are managed can help maintain balance and overall health. Next, number 17. Urinary incontinence. Urinary incontinence, or the loss of bladder control, can impact balance in older adults in several ways. The frequent need to urinate and the urgency associated with it can lead to hurried movements, increasing the risk of falls. Additionally, the discomfort and embarrassment associated with urinary incontinence can cause anxiety and distraction, further affecting balance. Older adults with urinary incontinence may also avoid physical activities or exercise due to fear of bladder leakage. This reduction in activity can lead to muscle weakness and decreased balance. A study published in the Journal of Urology found that older adults with urinary incontinence were more likely to experience falls and balance problems compared to those without incontinence issues. Managing urinary incontinence involves both medical and lifestyle approaches. Pelvic floor exercises, such as Kegels, can strengthen the muscles that support the bladder and improve control. Additionally, behavioral strategies, such as scheduled voiding and bladder training, can help manage symptoms. In some cases, medications or surgical interventions may be necessary. Addressing urinary incontinence and maintaining a regular exercise routine can help improve balance and reduce fall risk. Following that, number 18. Overuse of mobility aids. Overuse of mobility aids, such as canes and walkers, can sometimes contribute to balance problems in older adults. While these aids are designed to provide support and stability, relying on them too heavily can lead to muscle weakness and reduced balance skills. When mobility aids are used improperly or excessively, they can also create dependency and hinder the natural ability to maintain balance. A study in the Journal of Geriatric Physical Therapy found that while mobility aids can be beneficial for preventing falls, overuse or incorrect use can lead to altered gait patterns and muscle atrophy. This can ultimately reduce the effectiveness of the aid and increase the risk of falls. To address balance issues related to mobility aids, it is important to use these devices correctly and under the guidance of a healthcare professional. Regular physical therapy can help improve strength and coordination, reducing the need for mobility aids over time. Ensuring that mobility aids are properly fitted and adjusted can also enhance their effectiveness and minimize the risk of balance problems. Finally, number 19. Environmental hazards. Environmental hazards, such as uneven flooring, poor lighting, and cluttered living spaces, can significantly contribute to balance problems and increase the risk of falls in older adults. Hazards in the home environment can create obstacles and tripping risks, making it difficult to move safely. Uneven flooring or loose rugs can cause tripping hazards, while inadequate lighting can lead to difficulty seeing obstacles and changes in floor levels. Cluttered spaces can obstruct pathways and create risks for stumbling. A study published in the American Journal of Public Health found that home hazards are a major contributing factor to falls among older adults, emphasizing the importance of a safe living environment. To mitigate environmental hazards, it is essential to make modifications to the home to reduce fall risks. This includes removing tripping hazards, such as loose rugs and clutter, installing grab bars in bathrooms, and ensuring that all areas are well lit. Regular home safety assessments can help identify and address potential hazards, creating a safer environment for older adults and reducing the risk of falls. Here are 19 reasons you might be experiencing balance issues after 60. Many of these factors can be managed with the right approach. If you're worried about your balance, don't hesitate to consult a healthcare professional for personalized advice. If you found this video helpful, please give it a thumbs up and make sure to subscribe for more insights and updates.